Our next guest on Newsnight has now become an overnight celebrity after she successfully beat a coronavirus infection. 37-year-old Elizabeth Schneider, who is a marketing manager at a biotech company in Seattle, in Washington, in the United States, has been interviewed by tens of media houses, including CNN and Fox News, about how she overcame the infection. And now she grants Citizen TV her first interview to an African broadcaster. Elizabeth, thank you so much for speaking to us here on Newsnight. And let me get straight into it. You contracted the new coronavirus on the 22nd of February, 2020. Where were you? What was going on? And how did you realize that you had contracted this virus?
Yes, thank you. It's my pleasure to speak to you all. Yes, that's correct. So I happened to attend a house party on Saturday, February 22nd. It was a group of about 30 to 40 people. We just got together. We brought food to share. We were having, cocktails, drinks, beer and wine. And then, I had a great time. And, a few days later, I woke up in the morning. I started feeling tired, a little bit groggy. I thought that perhaps I had just kind of overdone it the previous weekend by going out a lot. Mm-hmm. So I just thought I would come home early from work, go to bed early. I went to the office as normal, and then around midday, started feeling really unwell. I felt a little feverish. I had a headache. I felt tired. I started getting body aches. So I went home. At that point, I worked from home the rest of the day. And by the early evening, I had taken a nap and I woke up and my temperature was 101 degrees Fahrenheit.
Okay,
and
by
the time I was getting ready to go to bed,
yes,
it had spiked to 103 degrees Fahrenheit, which is around 39 degrees Celsius.
That's right. So you're 103 degrees Fahrenheit, 39.4 degrees Celsius, while normal is between 36.5 to about 37.2. And so then how did you discover that you had the new coronavirus? Did you get some tests done?
Yes, that's a very interesting story. So I actually did not go to the doctor the whole time I was sick. So although I was a little alarmed at the high fever at that point, mm-hmm. I took some over-the-counter medication. So I took something we have in the United States called Excedrin. It's actually acetaminophen. It's very similar to like paracetamol that you guys have in other countries.
Yes.
So I went to bed and I woke up the next morning and my temperature had come down to 101 degrees Fahrenheit, 2 degrees lower. And so I decided at that point that I probably should just stay at home and rest and drink lots of water and continue, taking the acetaminophen to keep the fever down. It wasn't until a few days later, I happened to be scrolling through Facebook, that I saw one of the people who was at the party with me on that Saturday was also complaining of feeling ill, and she fell sick on the same day as me with very similar symptoms. Mm-hmm. And then about 12 to 15 other people who were at the party commented that they were also sick. All of those people, or most of those people, went to their doctors. Their doctors thought they had the flu. None of us had any respiratory symptoms. We didn't have cough, tightness in our chest or shortness of breath. So the doctors thought they had flu, tested them for flu, and it came back negative. So there was some frustration within the group that we were not tested, or sorry, I was not tested, but they were not tested for coronavirus. Mm-hmm. And so at that point, we came to know about a research study that was happening in Seattle. It's been going on even before the outbreak. It's called the Seattle Flu Study.
Okay.
There's some research institutes that are here, and I ended up getting tested through that.
And that's when you got the positive test case or result that you are positive, coronavirus positive.
Yes, that's correct. So initially they were only testing for strains of the flu as a flu study, as you might imagine. But as the outbreak started increasing, especially the epicenter in the United States being here in Seattle area, the researchers decided that it was in the public interest and in the public good to start testing for the coronavirus. So I got a positive test result call on Saturday, March 7th. Now, by that time, I was already mostly recovered, and I took the test, and it was an at-home nasal swab test kit. Okay. I did that on Sunday, March 1st, and so I mailed it off back to the researchers. And so by the time they got it in the mail and they did the test, they called me on Saturday, March 7th.
So I guess many are wondering, so how do you feel now? Are you self-isolating? What's going on?
Yes, I am feeling fine now. I am recovered. I don't have a fever. I don't have any of the symptoms that I was experiencing when I was unwell. Actually, as of today, it's been 21 days. It's been 3 full weeks since I fell sick. The guidelines as per our county health department, our public health department, were if you fall sick and if you believe you have the coronavirus or you've tested positive, please stay home for 7 days after the onset of symptoms or 72 hours after your fever breaks. And so when I got that call on Saturday, March 7th, I had already passed both of those deadlines. And at the moment, I'm way past those deadlines. And, I am able to go out into the public, but we actually are mostly staying at home here in Seattle. Our governor shut down restaurants and bars and banned groups of gatherings of people, of 50 people or more. We can get takeout and delivery from restaurants. So there's just not a whole lot of things to do right now in the city.
And I take it you're also working from home at this time?
Yes, I am. Most major companies and employers have asked their employees to work from home if they can work remotely. So I've just been working from home and doing remote conference calls.
Okay. So what's your message now for Kenyans? We have now reported 4 confirmed coronavirus cases in the country. What message would you have for Kenyans?
So first of all, I want to tell you that I'm so happy to speak to you guys. I've never had the pleasure to visit the African continent. So I'm hoping that some of you that are watching could perhaps meet me sometime when I visit Kenya. But the second thing I would definitely say is, please don't panic. Please do stay calm. This is effectively reaching all continents in the world, except I think at this point, Antarctica. It is something to be serious about. It's something to be vigilant about. But most of the people and the majority of the people that get infected with this virus do end up recovering, like myself, and I'm living proof of that. If you're healthy, if you're younger, if you're a non-smoker, you're likely to recover with symptoms similar to myself, like a cold or the flu. You may not have the cough or the tightness in your chest or the shortness of breath. The symptoms really vary from patient to patient. The other thing I wanted to say is that if you are experiencing any of these symptoms, please try and stay home from work. Please try and isolate from other people. That's the best way that we can help contain the spread of this virus and that we can protect the most vulnerable members of our communities, the elderly, people that are immunocompromised, have underlying health conditions like, heart disease, prone to heart attacks, people that are going through cancer, chemotherapy, pregnant women. So this is something serious that, we need to be vigilant about, but please stay calm. And also one last message I have for you: here in the United States, people are strangely hoarding and stocking up on toilet paper. And I just want to say that I don't know if that's hit Kenya yet, but I did not buy any toilet paper during the entire time that I was sick. So you don't have to worry about stocking up on toilet paper.
Thank you, Elizabeth. Yes, we have seen pictures of what's happening out there. And thank you so much for sharing that message of hope to Kenya. Elizabeth Schneider there, she works as a marketing manager at a biotech company, and she's a coronavirus survivor who is sharing her story to audiences around the world. And today she's spoken to us right here on Newsnight.